I see it all the time in the ER. A pregnant patient arrives, clearly uncomfortable, and when I ask how long she's been feeling this way, she says, for a few days. She didn't want to make a fuss. She thought it might just be part of pregnancy. Someone, somewhere, probably told her, "Oh, that's normal." Here's the truth. Pregnancy does bring new sensations, but certain symptoms are signals you should never dismiss. These aren't just discomforts. They're your body's urgent way of asking for help. Today, I'll share 7 pregnancy warning signs that I strongly encourage my patients, friends, and family to act on immediately. Some of these might surprise you, and one in particular is something most expecting parents never hear about. Have you ever ignored a small symptom only to later realize it was something important? Most people have. Our brains naturally try to explain away discomfort. But during pregnancy, that instinct can work against you. 1. The headache that doesn't quit. Many headaches during pregnancy are harmless. But if you ever get a severe, persistent headache, especially if it's paired with vision changes like flashing lights, blurriness, or double vision, that's a sign to call your healthcare provider immediately. Why? Because this combination can be linked to high blood pressure conditions in pregnancy that need prompt care. The key is to check early, not later. And by the way, symptom 5 on this list is one most people confuse with something harmless, and it's the mix-up that sends many pregnant patients to the ER. 2. Sudden, sharp abdominal pain. Your belly will have plenty of stretching and pulling sensations. Those are usually harmless. But a sharp stabbing or constant pain that doesn't improve with rest or position changes is different. Sometimes this can be linked to conditions that affect you or your baby's well-being, such as issues with the placenta or pregnancy developing outside the uterus. Both require immediate medical evaluation. Why do we sometimes downplay intense pain? Because the human brain tends to normalize discomfort when it happens gradually. But sudden severe pain is your body's way of saying stop and check now. 3. Heavy bleeding or a sudden gush of fluid. Light spotting after an exam can be normal, but bleeding like a period, passing large clumps, or soaking a pad quickly is not. Likewise, a sudden clear or pinkish gush could mean your water has broken earlier than expected. Both require you to contact your healthcare team or go to an emergency facility immediately. It's always better to get reassurance than to delay and risk missing something important. 4. Big changes in your baby's movement. Once you know your baby's pattern, any significant decrease in movement is worth acting on. If you feel unsure, drink something cold and sweet, lie on your side and focus on counting kicks. If you don't feel 10 movements within 2 hours, get checked, day or night. Why do parents sometimes wait until morning when they notice changes? Because uncertainty makes us hope for improvement. But with pregnancy, time is your ally only if you use it quickly. 5. Chest discomfort or sudden shortness of breath. Feeling slightly winded when climbing stairs can be normal late in pregnancy. But sharp chest discomfort, a racing heartbeat, or breathlessness even at rest should never be ignored, especially if it comes on suddenly. These can sometimes be related to heart or lung conditions that need urgent care. If this happens, get medical help right away. Coming up, sign 7 isn't physical at all, but it's one of the most important for keeping both you and your baby safe. I6. Sudden swelling, especially in one leg. A bit of swelling in the feet is common, but sudden puffiness in the face or hands, especially with headache or vision changes, should be checked for high blood pressure. Also, swelling in only one leg, especially if it's painful or red, can indicate a circulation problem that needs immediate evaluation. Why does swelling in one area matter more than swelling everywhere? Because localized swelling can point to an isolated blockage, something your provider can treat effectively if caught early. 7. Feeling overwhelmed or having disturbing thoughts. Mental well-being is just as important as physical health. If you ever feel persistent hopelessness, intense anxiety, or distressing thoughts, even if you'd never act on them, it's vital to reach out for help. You are not alone, and these feelings are more common than most people realize. There's free, confidential support 24/7, the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, and the Suicide and Crisis Lifeline at 988. Getting help is a sign of strength, and it can be life-changing for you and your baby. These 7 signs aren't meant to scare you. They're meant to empower you. You know your body better than anyone. If something feels off, act. It's always better to get checked and be told everything's fine than to wonder, what if? If you found this helpful, subscribe for more pregnancy insights and share it with someone expecting. You never know. This information could be exactly what they need at the exact right time.